So leadership is definitely where you want to go. If you still like the clinical side of things, or really almost like the patient care setting of the workplace or the hospital, then a nurse practitioner or a nurse anesthetist might be the perfect route for you, or even a clinical educator. That's actually a really cool role because you're still there. You're teaching your coworkers on how they should do things. You're teaching them about the latest trends or how they should do things or what's changing. And you're also teaching those new nurses that are just coming up about how to be a good nurse. So you're still there doing the clinical side of things with your peer, with your coworkers, but then you're also helping the future nurses on how to maximize their skills and be more efficient and just be better educated. It's almost like when you become a nurse educator, you reflect on almost in a sense of where nursing failed you or where school failed you or where the hospital failed you, and you try to correct that just so that doesn't happen to the future nurses. Because I guarantee you every single nursing educator out there became an educator because they wanted to do some kind of a change. They wanted to have an impact on either the current nurse situation or the future nurses situation, because at some point they felt like they were maybe not led in the right direction or just weren't giving enough. So it's almost like they want to make the unit a better place because the unit failed them in some kind of way. That's not necessarily like, I'm not saying that units fail nurses. I'm saying the nurses that become good nursing educators, they're usually coming from a place where they can see where improvement needs to be made and how things should move forward in like a clinical educational route. One of the routes that I'm thinking about pursuing is getting my psych NP. So just by getting your NP in really anything in family practice, men's health, all that kind of stuff, if you want to do more of the clinical acute setting, it's up to you. There's a lot of routes where the NP can take you. And the one I was looking into is psych. I always liked psychology. I always thought the brain to be interesting, the brain from a psychological standpoint, not so much the neuro ICU. I hate the neuro ICU. I'm more of a cardiac guy. But if when it comes to speaking to patients, maybe figuring out where they're coming from mentally, how they were raised, how that has impacted their lives, the feelings that they feel, that has always interested me. So the psych NP route I've always found interesting and something I'm definitely looking into and might pursue. But just being an NP, you're already starting off making $100K a year, which is nice. And plus you have more autonomy. You're still doing that clinical setting in a more specialized route, right? Like I really like talking to patients, going through their problems, going through their issues. So I like that part of nursing, not so much the more hands-on approach where it's like turning, maybe hanging medications, all that kind of stuff. Even though I do enjoy that, I'm trying to kind of push myself out of that and do something that I am really, really passionate and focused on. So that psychology aspect of things. A lot of nurses also become nurse anesthetists. That's probably the highest paying role you could have coming out of nursing school if you want to get that master's degree and pursue the nurse anesthetist route. And if you are thinking about that, I would say do that sooner than later, because I know some programs and some places are turning that into I believe a doctoral program. So if you still want to get, let's just say, grandfathered in to get the master's and become a nurse anesthetist, I recommend doing that sooner than later, because right now to become a nurse anesthetist, you need a couple years of experience in the ICU, and then it's 2 or 3 years of a graduate school versus doctoral, where it's going to take you even longer, more time in school to get that done.